a short introduction, I'll go on to the questions which we'll discuss today. So actually, since you all are here, you have achieved the first step in your entrance preparation. That means you all are here because you have a dream, you want to pursue your entrance. So that means the first step in cracking an entrance examination is to have a dream. That means you should have a desire to achieve a post-graduation, to crack the entrance examination with good ranks and acquire post-graduation. And not just a desire, it should be a deep burning desire that will help you to keep moving throughout the journey. And we'll be there with you in this journey, guiding you, motivating you, and helping you in all the possible ways. Okay, so today we'll be discussing on pharmacology. Pharmacology is a very volatile subject as well as a very difficult subject right from your BDS time. Very difficult to remember the classifications, very difficult to remember the main parts. So what we do here is we'll discuss the questions in such a manner that mugging up the MCQs in pharmacology, not only in pharmacology, in any other subjects, it won't benefit you. So you have to know the basic theory behind it to certain extent, or to that part of the theory which is very important, not the entire theory. So we'll be discussing each question. While discussing each question, we'll discuss the relevant theory part and the associated questions which come. Okay. So today we'll be discussing a few questions. So Young's formula. Young's formula for a child dose of a drug is calculated on the basis of, this is one of the most important question which was asked in 2020 NEET as well as in 2019 NEET. It was frequently asked. So it was asked in different methods, and the options given are dental age, body weight, body surface area, chronological age. So how do you approach this question? To approach this question, we have to know actually what is Young's formula. Since it was asked frequently in the coming years, you have to know just not the Young's formula. You have to know all the other formulas for calculating the dose of a drug. How will you approach it? So for calculating the dose of a drug, it is based on three methods: based on body weight, based on age, based on body surface area. So based on body weight, what's the formula? Clark's formula. That means the child dose is equal to body weight in kilogram into average adult dose divided by 70. If it is in kilogram, divided by 70, because the average adult weight is considered 70. And if it is in pounds, body weight in pounds means divided by 150. So that is a formula for calculating the dose of a drug based on body weight, Clark's rule. And based on age, we have three formulas. Young's rule, in which the child doses age of the child into adult dose divided by age plus 12. Age of the child into adult dose divided by age plus 12. And another formula is there, that is Dilling's formula, which is child doses age of the child into adult dose divided by 20. Fred's formula, age of the child in months into adult dose divided by 150. And in all the others, it was age in years. But here in Fred's rule, it is age in months. Young's, Dilling's, and Fred's. Then we have the body surface area. Based on body surface area, doses body surface area into average adult dose divided by 1.7 or 1.85 millimeter square. Because that is the average adult body surface area considered, 1.7 to 1.85. Both are right. Meter square. So Dose based on body surface area is body surface area of the child in meter square into average adult dose divided by 1.7 or 1.85. So this much formulas you have to know, basic. In detail, we'll go on in the regular classes. So when this is asked, when Young's formula is asked this much times, you're supposed to know all these formulas. Anything can be asked in reverse manner. Okay. So now you can attempt this question. Young's formula for a child dose of a drug is calculated on the basis of dental age, body weight, body surface area, chronological age. So it's clear. It is chronological age. Now, what if the options were given as option A, dental age, B, biological age, and C, mental age? What will be the answer? Again, the answer will be chronological age. Chronology. What is chronological age? It is an age based on the on your date of birth. That is how long you were alive, based on your date of birth. That is chronological age, a normal age. What is biological age? Suppose a person is 30 years old, and the body of the person is maintained in such a way that when you see the person, you will feel that person is only 25 years. So that 25 is a biological age. So that's not the age which is considered for calculating the dose of the drug. Now, suppose that a person aged 30 behaves in such a manner that you feel that the person is only 3 years old. So that is the mental age of the person. So in calculating the dose, it is chronological age. Even if these options were given to confuse you. Okay. Now we'll move on to the next question. The recommended mode of administration of adrenaline in case of anaphylactic shock. The recommended mode: subcutaneous, B, intramuscular, C, intravenous, D, intracardiac. It was also, this question was also asked in the previous 2 years. It was continuously asked. It was asked as the drug of choice. So you have to know what is the, yes, very good. You have to know what is the drug of choice in that, how it is administered. At the same time, you have to know the other drugs given in case of emergencies. So the dose of adrenaline is 0.3 to 0.5 milligram, 1 in 1000, IM, intramuscular or subcutaneous. But in case of emergency, it is given as intramuscular because intramuscular is highly vascular. So to get a quick response, it should be given in the intramuscular route. If intramuscular is not there, you can go for subcutaneous in the options if it is not there. Okay. The other drugs, dopamine to overcome the hypotension in anaphylaxis, antihistamines to overcome the allergic response, corticosteroids to overcome the edema. These are the other drugs which are given in anaphylaxis. Also, what is the drug of choice in angina? Emergency drug of choice in angina. Glyceryl trinitrate, 0.5 milligram sublingually. The emergency drug of choice in angina, glyceryl trinitrate, 0.5 milligram sublingually. Asthma, salbutamol, 100 microgram, salbutamol, 100 microgram. And it is given as metered inhalational dose. Status epilepticus, the drug of choice. Lorazepam, it is a drug of choice, 4 milligram IV. And if lorazepam it is a first drug of choice because you will get the desired effect with lorazepam. If lorazepam is not there in the option, you can go for diazepam, 10 milligram IV. These are certain drugs which are given in emergencies. So that's how you have to learn. Adrenaline is given for anaphylaxis, that you all know. But since it is repeatedly asked in the few years, you have to know all the drugs in the emergency drugs used for all the purposes. Okay, and the detailed drugs or the other drugs which are given in angina, asthma, status epilepticus, we'll discuss all that in our regular classes. So now you can go with the answer. The recommended mode of administration of adrenaline in case of anaphylactic shock. The recommended: subcutaneous, intramuscular, intravenous, intracardiac. It is intramuscular. So this is how you go approach each question. Not just you can't just read the question, go check the answer. You have to know all the relevant details associated with that particular questions. Excuse me. Okay. which of the following is not a side effect of ACE inhibitor? Which of the following is not a side effect of ACE inhibitor? And this question was also asked twice for the 2020 NEET. Option was cough, dysgeusia, angioedema, hypokalemia. How will you approach this question? Yes. So how to approach this question? If such a question is, it is being asked repeatedly. You have to know what is an ACE inhibitor. ACE inhibitor is an antihypertensive drug, angiotensin converting enzyme inhibitor. It is an antihypertensive drug. So it comes, another topic comes. You have to know about the hypertensive drugs also. So this is the renin-angiotensin system. Sorry, the renin-angiotensin system. Before coming to that question, we'll see what is renin-angiotensin system. So, when there is, I'm sorry, just a second. Okay, we'll continue. So, the renin-angiotensin system. You have to know what is a renin-angiotensin system. I'll tell in short. Whenever there is reduced blood supply in the kidney, the juxtaglomerular cells of the kidney will release renin into the circulation. This renin will go and convert the angiotensinogen released from the liver to angiotensin 1. Renin released from juxtaglomerular cells converts the angiotensinogen released from the liver to angiotensin 1. Angiotensin converting enzyme, which is present in the vascular endothelial cells of the lung, converts angiotensin 1 to angiotensin 2. What's the role of angiotensin 2? The angiotensin 2, as such itself, it is a vasoconstrictor. It will cause vasoconstriction, increase the BP. And this angiotensin 2 will cause the release of aldosterone from the adrenal cortex. What is the role of aldosterone? Aldosterone increases the reabsorption of sodium. As a result, water is also reabsorbed. So, the electrolyte balance is maintained. Since sodium is reabsorbed, it causes excretion of potassium to maintain the normal electrolyte balance. That is the role of aldosterone. Now coming to the kinin-kallikrein system. What is kinin-kallikrein system? The low molecular weight kininogen released from the liver is converted to bradykinin with the help of kallikrein. This bradykinin is mainly associated with inflammation, coagulation, reducing the BP. That is the role of bradykinin. So, this kallikrein converts low molecular weight kininogen to bradykinin. And the ACE, angiotensin converting enzyme, also converts bradykinin to inactive bradykinin. Role of bradykinin is, it is a main mediator in inflammation. It causes pain, it causes coagulation, all the mediators of inflammation. That is the role of bradykinin. So this angiotensin converting enzyme also inhibits the conversion of, is also involved in the conversion of bradykinin to inactive bradykinin. So what we are doing here, what is the drug asked in the question? This angiotensin converting enzyme inhibitor. So once it is inhibited, bradykinin won't be converted to inactive bradykinin. Lot of bradykinin will accumulate, which will result in excess action because of the bradykinin. What are the actions? We'll see in the next slide. Also, in the upper one, in the renin system, angiotensin converting enzyme inhibitor, which when we give, angiotensin 1 is not converted to angiotensin 2. So there is no vasoconstriction of angiotensin 2, no effects of aldosterone. Okay. So what will be the result? Before going to that, the drug of choice in the question was a angiotensin converting enzyme inhibitor. It comes under renin-angiotensin system inhibitor. It is an antihypertensive drug. The prototype drug in the group is captopril. The other drugs are enalapril, lisinopril, benazepril, ramipril, all the prils that comes under ACE inhibitor. So by converting angiotensin converting enzyme in the inhibitor, it will cause the accumulation of bradykinin in X. This bradykinin is the cause of cough, because bradykinin is not converted to inactive bradykinin because we are giving angiotensin converting enzyme inhibitor. So this this bradykinin gets accumulated and it will result in cough, angioedema. And since aldosterone is not formed, normal role of aldosterone is to reabsorb sodium, remove potassium. So aldosterone is not there. So what will happen? Potassium is lost. It causes hyponatremia and hyperkalemia. Hyponatremia and hyperkalemia. The opposite, reverse action of aldosterone. That is the cause of hyponatremia and hyperkalemia in angiotensin converting enzyme inhibitor. And also hypotension is also caused because of the accumulation of bradykinin. Also, it has another effect, that is it retards the growth, it causes death, fetal death, alteration in taste sensation. All these are the effects of angiotensin converting enzyme inhibitor. Which of the following is not a side effect of angiotensin converting enzyme inhibitor? Cough, dysgeusia, angioedema, hypokalemia. Yes, very good. The answer is hypokalemia. Actually, this angiotensin converting enzyme inhibitor will not allow the release of aldosterone. Aldosterone causes absorbs sodium, releases potassium. So either reverse, the reverse of that will happen if you inhibit angiotensin converting enzyme inhibitor. It will cause hyponatremia and hyperkalemia. It's not hypokalemia, it's actually hyperkalemia. So the answer is option D. So I hope now the role action of angiotensin converting enzyme inhibitors are clear. That's how you go. It's not just, you can't just learn these 4 options because you may get the related questions. You have to know the theory part. So in this manner, we'll explain all the theory, the relevant theory of every questions. Which of the following is a prodrug? Methyl dopa, morphine, enalapril, theophylline. To know that, what is actually a prodrug? That is, it is an inactive drug which is transformed. Yes, we'll come to the answer. It is an inactive drug which is transformed in the body to an active metabolite. Inactive drug transformed in the body to an active metabolite. There are various inactive drugs. This prodrug was also asked in the previous NEET questions. That is, some options will be given and you'll be asked to identify which will be the prodrug. So it is actually an inactive drug which is transformed in the body to an active metabolite. So the first column, the drugs in the first column are the prodrugs, and the second column you have the active form of that drugs. So just to remember the because it's not easy to remember in the entire many prodrugs. You'll remember the common ones, but if the other drugs are asked, it will be difficult to remember. So I've just put a match the following. So once you try a match the following, the name of the drugs will be familiar to you. First one, let's attempt this match the following. So prodrug, enalapril. What is active form of enalapril from this options? It is enalapril. Names are similar, just to make you familiar with the names of this prodrugs. Okay. Alpha methyl dopa, which is the prodrug, which is the active form of alpha methyl dopa. The names will be almost similar. So you can just go through the option, the second column, alpha methyl dopa, the prodrug. It is alpha methyl norepinephrine. Dipivefrin, epinephrine. Prodrug proguanil, cycloguanil. Becampicillin, ampicillin. Sulfasalazine, 5-aminosalicylic acid. Levodopa, dopamine. Acyclovir, triphosphate. Cyclophosphamide, aldophosphamide. Yes. And the last one, mercaptopurine, It is methyl mercaptopurine. They have never asked the prodrug and its active form. It is not asked like that, but this thing is, you will get the questions and which among the following is a prodrug, like that in different options. The question is has been repeated in many years. Which among the following is a prodrug? So while doing this match the following, the prodrug names will be familiar to you. That is the purpose of giving such a task, okay? There are similar portions in pharmacology which will be very volatile for you. So in the regular classes, we'll be giving assignments so that you'll be able to recollect it. The difficult part will be giving regular assignments so that you can recollect it. That is the only method to learn pharmacology. Repeated reading, repeated learning of all the difficult parts. Okay. Now coming to our last question. So which of the following is a prodrug? The answer is clear now. Methyl dopa, morphine, enalapril, theophylline. It is enalapril. A junior anesthetist. Now we come to the last question. A junior anesthetist accidentally injects a parasympathetic drug in a patient. Which of the following will be seen? Increased heart rate, urinary retention, meiosis, increased sweating. So it is a parasympathetic drug. What is a parasympathetic drug? It is to attempt it. Yes, very good. Before coming to the answer, we'll see what is a parasympathetic drug and what are the other actions of parasympathetic drug. So parasympathetic is a part of an autonomic nervous system, which is called craniosacral, and this parasympathetic craniosacral outflow and parasympathetic is associated with rest and digest. And you have the sympathetic system, which is associated with fight and flight reaction. It is thoracolumbar and sympathetic associated with fight and flight reaction. Now coming to the neurotransmitter. The first one is a parasympathetic. So you have the preganglionic fibers, the ganglion, the postganglionic fibers. Neurotransmitter in pre as well as postganglionic fibers is acetylcholine. Acetylcholine for the parasympathetic. Whereas in sympathetic, it is acetylcholine for the preganglionic fibers, whereas postganglionic fibers, it is mainly noradrenaline, and for some fibers, it is acetylcholine. Okay. And we have the cholinergic or the parasympathetic drugs and the sympathetic drugs. We'll discuss each one in detail while going, because several questions are asked from this part, sympathetics and the parasympathetics. It will be discussed in detail while we go through the, during our regular classes. Okay. So the question was parasympathetic. The main drug, there are two groups, cholinergic agonist. The prototype drug in that group is acetylcholine, pilocarpine, and you have the anticholinesterases. And the anticholinesterase means cholinesterase inhibits acetylcholine. Anticholinesterase inhibits cholinesterase. So, and acetylcholine is not inhibited, and it will be available readily for more amount of acetylcholine will be available for action. The prototype drugs are physostigmine, neostigmine, etrophonium, and organophosphates. Irreversible one. So now coming to the question part. Okay. I told you parasympathetic is associated with rest and digest. So in heart, what will be the action? Bradycardia, because it is resting. So bradycardia. Rest and digest. So in blood vessels, what will be the action? Resting. So BP is decreased. Blood vessels are dilated. Smooth muscles. Parasympathetic is associated with rest and digest. So the smooth muscles will get contracted. That means digestion should take place. Peristalsis is increased. It causes bowel evacuation, voiding of urine. And since smooth muscle means, in general, every smooth muscles undergo contraction. Also bronchospasm. Glands. Parasympathetic is associated with rest and digest. So in order to undergo digestion, all the secretion, saliva secretion should be increased. So just remember that all the secretions are increased. Eye, rest and digest. Rest means just close the eyes, meiosis. Meiosis means contraction of the pupil. So just rest and digest means sitting relaxed, so the eye undergoes meiosis. These are the actions of parasympathetic. And decreased intraocular tension. So now attempting this question. A junior anesthetist accidentally injects a parasympathetic drug in a patient. Which of the following will be seen? Increased heart rate, urinary retention, meiosis, increased sweating. Meiosis. So you should also know the opposite to that is the action of sympathetic. That's how we go. So it was a brief discussion of a few questions. That means just to tell you that it is not possible just to go through the question, the answer. You have to know the relevant theory parts. And reading the entire theory during the 1 year preparation may not be easy for every subject, reading every subject, theory part of all the subjects. So we'll be discussing in the regular classes, we'll be discussing the relevant theory portions. Any clarification if you want on any specified theory, it will be clarified. And that's all for now. So have a enjoy your New Year celebrations. Have a nice year. See you all soon. So with that, we'll wind up today. Okay. So thank you. We'll stop by today. See you all for the regular classes. Okay.